President Obama kicked off the week with a more aggressive tone on what he expects from Congress regarding health care. He addressed a charged-up audience, saying that even a good debate eventually has to end.
At some point, it's time to act. Ohio, it's time to act and get this thing done.
Tuesday afternoon, Mr. Obama met with Democratic congressional leaders to create a strategy the day before his planned speech to the nation on health care, a joint congressional address that some experts say is his most important of his presidency so far.
The fact is, we have waited too long in this country to have this conversation and to make these changes. So it's kind of time for us to own up now and take responsibility for that and realize we're going to have to make some tough choices. Some of them are not going to be easy. Some of them are not going to be simple. But there are choices that we have to make to kind of turn this ship around.
President Obama is attempting to conquer what previous presidents have failed to do. The last administration to make health care a top issue was President Clinton, who was defeated when Democrats could not unite around a universal health care plan. The president faces attacks from conservatives and Republicans who argue that Americans' taxes will rise and that seniors will lose coverage options they rely on to survive.
There's a lot of money being spent on people who are uninsured right now to give them medical care. That's the place where you can find the money to pay for giving them health insurance. That's not what these bills are doing, and that's another problem.
The White House dismisses these tactics as lies.
Their answer is to do nothing, and we know what that future looks like. Insurance companies raking in the profits while discriminating against people because of pre-existing conditions, denying or dropping coverage when you get sick.
Most Republicans and conservative Democrats oppose a public option, fearing that it will create a healthcare system run entirely by the government.
There is a fiscal emergency right now in Washington that is getting worse year by year, and I think the healthcare plan might be throwing gasoline on this emergency we already have.
One thing Democrats and Republicans agree on is the need for specifics. Many hope that the president addresses the details in his joint congressional address on Wednesday. Republicans say they'll continue to work on an agreement even if it will most likely not include a government-funded option. Republican Senator Chuck Grassley of Iowa says that Republicans currently have 4 plans that are better at overhauling the U.S. healthcare system than the popular versions being floated around. Colin Campbell, Washington.